Okay, so welcome everyone. Thank you for joining us for today's webinar. My name's Madeline Enright and I'm a Project Officer at ACTA, the Australian Clinical Trials Alliance. So the topic of our webinar today is accessing linked data for clinical trials, presented by Dr. Felicity Flack and Dr. Natalie Ray. This is part 2 in a 4-part series on linked data for clinical trialists. Before we get to the main presentation today, I just have a couple of acknowledgements and housekeeping items. First and foremost, I'd like to acknowledge that this project has been a collaboration between ACTA, the Population Health Research Network, and the Australian Research Data Commons, who in turn receive support from the Australian Government through NCRIS. I'd also like to acknowledge the operational funding ACTA received from the Australian Government's Medical Research Future Fund. So just a quick reminder that these webinars are being recorded and they will be available on our website shortly. So if you've missed part 1 or you want to review anything we covered today, please head over to clinicaltrialsalliance.org.au and you'll find the relevant links in our latest news section. If you have any questions during the presentation, please type them into the question box in your GoToWebinar control panel. I'll bring them up at the designated break around halfway through, and we will also have some time for questions at the end. Okay, so with that out of the way, I'm now pleased to introduce our first presenter for today, Dr. Felicity Flack. Felicity is the Manager of Policy and Client Services for the PHRN, the NCRIS-funded National Data Linkage Infrastructure. In this role, she oversees the coordination of applications for cross-jurisdictional linked data projects. She is also the chair of the Sir Charles Gairdner Hospital Human Research Ethics Committee and is writing a book on the ethics, law and policy of using linked data for research. Welcome, Felicity.
Thank you, Madeline. Thank you for your kind introduction. And welcome back to everybody who was with us last week and to those of you who are joining us for the first time today. As Madeline mentioned, we talked about designing clinical trials last week, and so if you want to catch up on last week's content, you can go and check out the webinar from last week. But this week we're going to be talking about how to access linked data for clinical trials. And as Madeline mentioned, this is part of a 4-part webinar series, and the overall objectives of the whole series are to demonstrate the benefits of using linked data in clinical trials research, to assist clinical trials researchers to design clinical trials using linked data and apply for access to linked data, and to introduce clinical trials researchers to the PHRN facilities and services available. And the impetus for this webinar series has come from collaboration between ACTA and the PHRN. So today, I hope by the end of it, you'll be able to explain the 3 describe the 6 steps in the process to access linked administrative data, and also have a bit of an understanding about current timelines and costs involved in accessing linked administrative data. So we're going to divide this webinar into 2 parts. I'm going to start and talk a bit about the data linkage process itself and how we do that, and a bit about what cross-jurisdictional data is and how data is linked across jurisdictions. And then I'm going to hand over to Natalie Ray, who's going to talk more about the actual process and so that the 6 steps in the process for accessing linked administrative data. After my section, I'll answer a couple of questions if you have any, and then we'll hand on to Natalie, and there'll be some more opportunity to answer some questions at the end. Okay, so let's get going. So firstly, what do we actually mean by data linkage? Well, it's important to remember that this is nothing new. This is something that researchers have been doing for a very long time. And this is my favourite description of what data linkage is, and it comes from Dunn in 1946. So each person in the world creates a book of life. This book starts with birth and ends with death. Its pages are made up of the records of the principal events in life. Record linkage is the name given to the process of assembling the pages of this book into a volume. Events of importance worth recording in the Book of Life are frequently put on record in different places since the person moves about the world throughout his lifetime. This makes it difficult to assemble this book into a single compact volume, yet sometimes it is necessary to examine all of an individual's important records simultaneously. It's necessary at times to link the various important records of a person's life. But a simpler way of putting that is that data linkage is a method of bringing together information derived from different sources but relating to the same individual or event into a single file. And that's what we mean when we're talking about linked data. So who's involved in this linkage process? Well, there are three main groups that are involved in the process. And the first are the data custodians. And these are the people who have the responsibility for the data collections. They may actually collect the data, or they may, if you're a government data custodian, be the person legally responsible for managing and looking after that data. You as clinical trialists can also be data custodians. So a research group which collects data is the custodian of that data. The second group of people involved in the process are what we call data linkers. And these are the people who create the links between the data from different sources. And sometimes we say they create linkage IDs. They create a person-specific number for each person in the data sources that they're linking. We'll talk about that more in a moment. And then finally, there are the data users or the researchers. That's you, the people who use the data for analysis and research. And the actual process of data linkage also has three basic steps. The first step is separation, and this is where the data custodians separate the identifying information. What we would probably mostly use would be name, address, date of birth and sex. We separate that from the rest of the record, which is what we call the content information, which would be things like the diagnosis or the clinical details in a record. The second step is the creation of linkage IDs. That's creating the links, identifying which people are in the same, each of the data sets, essentially. So if person A is also in dataset A and dataset B. And then finally, the third step is the provision of the linked data to researchers. But let's talk through this in a bit more detail. How does it actually work? So this is a little case example, and when we talk about a person who we're calling any citizen. So in this example, there are two different data collections. The first is the hospital admitted patients collection, which is held by the health department, and is a legislative requirement for the health department to collect and maintain. And the second collection is the registry of births, deaths and marriages, which is also a legislative requirement of government, and the registrars hold a record of every birth, death and marriage in their jurisdiction. So two data collections, two different data custodians. And here's an example of one record which is held by each of these data custodians. So on the left there you can see the health department record, and you'll see that the person whose record it is called any citizen, and then the right hand side you can see a death record, and the name is similar, although in the death record there's a middle name. So if you just eyeball the two records, you can see that they're similar, but there also are some differences, not just in the way the data is recorded about the person, but also in the way the data is coded. So for example, sex in the hospital collection is coded by a numeric code, and in the death collection it's coded by M or F, actually. So that's important to note, that data collected by different data collections is stored and formatted in different ways. It's also important to note that each record has a record ID, which is a unique number for that particular record. So the first step that I mentioned before is separation. So the first step in this process is that the data custodians separate the data in these two records and take a copy of the identifying information, which they then send to a data linkage unit, which is a specialized unit that often sits within a health department that is just set up to create these links. That is their only job. And when the two records arrive at the data linkage unit, the data linkage unit use a probabilistic algorithm to decide whether any citizen in the hospital record is the same as any citizen in the death record. And in this case, they say, yes, it is the same person. Now, if they had never seen any citizen before, they create a new, what we call linkage ID for any citizen, which is just a unique person-specific alphanumeric number for any citizen. If they had seen records from any citizen before, they just would have used the existing number for any citizen. And this process happens routinely for these big administrative data sets, things like the hospital and death records. So on a regular basis, and it could be anything from weekly to annually, the data custodians go through this separation and send the identifying information to the linkage unit, who looks to see whether they've seen these records before and allocate linkage IDs. Now, if you're a researcher, for example, you're running a clinical trial and you'd like to do a long-term follow-up of your cohort by linking to hospital records and death records, you'll need to get some approvals first. You'll need an approval from each of the data custodians, so one from the hospital custodian and one from the Registrar of Births, Deaths and Marriages, and also you'll need an ethics approval. Once you've got those approvals, the linkage unit will look at your criteria for your cohort and work out which records are going to be needed for your study. And then they'll create a specific project linkage ID for your study. And sometimes in a clinical trials format, if you're providing data in for the linkage, they might use the linkage ID that you've provided. But anyway, a project linkage ID specific for that project will be the ID number used. The linkage ID that the linkage unit create to maintain their catalogue of records never gets released to anybody. And this is to ensure that people can't link between different research studies without approval. So linkage ID doesn't get released. The linkage unit then sends the project IDs and the record IDs for the relevant records back to the data custodians, who then go through another separation step. But this time they replace the identifying information with the project IDs, and they send that data back to the researcher, who's then able to use the project IDs to merge the data and do their analysis. So that's how, in general, all of the linkage occurs at linkage units around Australia. I mentioned briefly before that we mostly use probabilistic linkage, which is working out the probability that any citizen in the hospital record is the same as any citizen in the death record. But there are other ways of doing linking, including manual linking, which is just looking at two records and deciding yourself whether it's the same person or not. That, of course, is very labour intensive and is not something that gets done very often anymore. And the other method is deterministic linkage, which is involving an exact match or agreement on selected match variables. That could be one variable, for example, some kind of ID number, or it could be multiple variables. So you say if it's the exact same name, address, and date of birth, then it's that person. And if any of those things are not an exact match, then there's no match. And there's also the possibility to do both probabilistic and deterministic linkage as well. Now I'm going to move on and talk a bit about cross-jurisdictional linkage. And firstly, to talk a bit about why it's important that we're able to do cross-jurisdictional linkage in Australia. I'm sure you're all very well aware of the Australian political system and our health system, but this means that cross-jurisdictional linkage is really essential in Australia for research because of our federal system. We have states and territories and the Commonwealth, and also we have a health system which is partly Commonwealth funded, partly state funded, and there's a significant private sector as well, which means that different jurisdictions and different organisations are collecting the information about each person over their lifetime and their health journey. So, for example, the states and territories collect birth records and midwives records and hospital records, and the Commonwealth collects things like the PBS data and the MBS data and Veterans Affairs and ageing data. So in order to be able to look at data from people across the country and their whole health journey, it's really important to be able to link to data from different jurisdictions. So just to give a clearer example of what I mean by cross-jurisdictional linkage, this is the linkage of data from individuals that's held in different jurisdictions. For example, you might want to link hospital data from people in both Western Australia and New South Wales, or hospital data from Western Australia with Commonwealth PBS data. And as I mentioned before, that's important because health data is held in different jurisdictions, but also because Australians are mobile. They have health services in multiple jurisdictions, and sometimes it's really important to know that. Other reasons to do cross-jurisdictional include increasing the statistical power for research, particularly if you're looking at rare conditions. You may not be able to get sufficient data from one jurisdiction. Of course, one jurisdiction doesn't always collect all the data that's required to answer your particular research question. You would definitely need it to assess cross-border usage of services, and also to obtain accurate data for longitudinal studies, which might be the most common thing you might use it for in clinical trials. You may have recruited somebody into a clinical trial in New South Wales, but if you want to do a long-term follow-up of that trial, you would also want to know whether they'd been hospitalised in the years since the trial ended outside of New South Wales. So here's just a little flow diagram of how that might actually work, how the data would be moved around to do cross-jurisdictional linkage in a clinical trial. So in this example, we've got a multi-site study which has study sites Victoria, New South Wales and Queensland. And in this example, and there are permutations and combinations of different ways you could do it, but this is just an example. Each study site would send the identifiers, name, address, date of birth, and a unique study ID for that person to the data linkage unit that's going to do the linkage. That linkage unit would link to, in this case, the hospital data collections and the death data collection, and use that study ID that the study sites had created as the unique person ID for this project. They would then send that study ID and the record ID to each of the data custodians, who would extract the relevant data for the study and then send that data to the central coordinating site if that was the site that was going to be doing the analysis for the clinical trial. So that's it from me. Does anybody have any questions? Madeline, have you had any questions come in yet?
Hi, Felicity. So no, haven't had any questions come through just yet. So just a reminder to our attendees, if you do have any questions, just type them into the questions box in your control panel.
That's fine. If we haven't had any questions, people can put them in as they come to their minds. And I might pass over to Natalie Ray. Natalie is the Coordinator of Policy and Client Services for the Population Health Research Network, and in this capacity, she is the person who receives all the applications for cross-jurisdictional data linkage and coordinates the responses from all of the jurisdictions and can provide advice on how to approach accessing cross-jurisdictional data across Australia. So I think she's going to be very helpful for you in a practical sense about how you go about doing this. So I'm just going to take my headphones off and hand them over to Natalie.
Felicity, just before you. Natalie, we've just had a couple of questions come through for Felicity, if you wouldn't mind putting her back on the line.
Certainly. Hold on a minute. There's some questions for you.
Sorry. You probably can't see me, but you can hear me.
Thanks, Felicity. So we've had a question come in here from Gordon. He's just asking, what are the biggest barriers to efficient data linkage in Australia?
Oh gosh, that's a big question. The simple answer is the biggest barrier, I think, is federation. Because of the way our political system and our health system is set up, and that data is not collected centrally anywhere, it's much harder for us to get linked data, national linked data, than it is in other similar jurisdictions. So, for example, in Canada, each of their provinces actually collect all their pharmaceutical data, most of their health data is collected at a provincial level. So you can do an awful lot more work with linked data at a provincial level. Whereas in Australia, we just have to get the linkage across jurisdictions, and that runs into both legal but also cultural and administrative issues.
Great, thank you so much, Felicity. A couple more have come through.
Okay. Oh, okay.
So
maybe do one more.
Okay, just
move
one more?
on.
All right. So we've had a question come through. Why can't we use Medicare for linkage in Australia for deterministic linkage?
The answer is you can.
That's a simple one then.
So the approvals can take some time, but you can actually do it.
Great, thank you.
All right, I'm going to hand over to Natalie now.
Thanks, Felicity. Okay. So, as Felicity and I think Madeline mentioned earlier, my name's Natalie and I'm the Coordinator for Policy and Client Services at the PHRN, and I'll be talking to you this morning, or this morning if you're in WA, but maybe this afternoon if you're on the East Coast, about applying for linked data. Okay, so the first thing I'm just going to give a brief overview of Population Health Research Network, just so you're aware of the services and the facilities that we can provide. So the PHRN is a national data linkage unit. I've already made a mistake. A national data linkage network, and this map highlights the network's components. PHRN currently supports state data linkage units, and these are signified by the red dots on the map. You'll notice that there's a data linkage unit in every state and territory, and there's also one federally. The federal data linkage unit is represented by the dark grey dot, and that's based at the Australian Institute of Health and Welfare in Canberra. Now, we've also got a light grey dot, and that represents a secure remote access data laboratory. And that's a computing environment which allows researchers to access and link data for approved studies in Australia. And then we have the yellow dot, which represents our secure file transfer system, and this is run out of Curtin University. Now, the secure file transfer system is known as Suffix, and that's one of the options that data custodians can use, and data linkage units too, to safely and securely send files to the linkage units and researchers. We also have the last dot is the orange dot, which is actually a national coordinating office, which Felicity and I are based in. The online application system is also, I was going to say based here, but it's operated from the coordinating office. and that service is available on the PHRN website. Okay, so let's get down to business. How do we apply for linked data? Okay, so we've highlighted, we'll go through a number of steps that'll get you from the application stage to hopefully receiving the data. So the first step is the clinical trial design. So the first step is in the process is to design your trial using the data and methods which are appropriate for achieving the aims of the trial. So you will need to design a research protocol which will meet your needs, and then you'll have to submit an application form. Now, the data application form could either be the PHRN online application system form, or you could be just doing wanting linked data from one jurisdiction, and that would just require you to apply to one jurisdiction and complete their state-specific data application form. So when you're thinking about designing your trial and putting together your protocol, there's a few key questions you probably want to ask yourself. And the first one is, what data? Now, when we say what data, you might think, what do they mean? So we're thinking about what's being collected as part of your clinical trial, what information is the clinical trial collecting that will aid the data linkage unit to clinical trial participants, to the administrative data sets, and also what administrative data sets are important to your clinical trial to answer your question. For example, you may be interested in if the participants have been hospitalised in another state, or 5 years after the completion of the clinical trial, like what's happened to these participants. So to do a sort of study like that, you might require the admitted patient data sets or emergency data collections, and also the National Death Index. So it's just thinking about what questions do I want to ask, what sort of outcomes am I looking for, and thinking about what the data sets are that will help you answer those. Another question is, when will linked data be used? So you'll have to actually think about when you want the data to be linked and delivered, and would you be wanting a one-off extraction, so getting all the linked data at the one time, or would it be better for your project to receive annual updates? So there's some things that you need to consider about that. And then the next question, how will it be linked? We encourage all researchers to contact the client services officers right at the beginning when you first start considering preparing a protocol or an application for linked data. So if you get to the point where you're thinking, how will this data be linked, and you're not sure how, this is time to call the data linkage unit in your jurisdiction or in multiple jurisdictions if that's what your application is going to include. And you'll be able to find the client service officer's contact details on the PHRN website. So keep in mind that linked data projects can be complex projects, especially if you're wanting to link data from more than one jurisdiction, and the client service officers are there to help you. And they can help formulate a data flow diagram. So thinking about what sort of software packages you might need, what sort of analytical tools will be used. And you'll just need to identify data collections to be used in the analysis and consider what your methods will be to conduct the analysis. When you're thinking about how the data will be managed, you'll need to consider things like what location will the data be stored in and analysed in. You'll need to draft a security plan that shows that you've thought through the different steps of how to keep the data safe. You'll need to think about how long the data will need to be stored for, when the data will need to be destroyed, and how will it be disposed of. So these are all things that you'll need to consider putting in your research protocol and subsequently your application for data. Okay, so you've got your research protocol, everyone's sort of happy with it, you're ready to submit a data application. If you're applying for data from a single jurisdiction, you just have to complete that one application form for that jurisdiction. The example I'm giving on the slide is if you're applying for data from the Centre for Victorian Data Linkages, which is based at the Department of Health and Human Services in Melbourne. So if you go onto their website, they'll provide 3 different documents you can download. And these are the data linkage request form, the data linkage request information pack, and the data variable list. So the information pack's really useful. That will outline the process of applying for linked data in Victoria. And then you'll need to complete the data linkage request form and the data variable list as your complete application form, and to submit that to the data linkage unit, along with the protocol and any accompanying documentation that you may have at that stage. If you decide you want to go with the whole cross-jurisdictional linked data project, which might suit a lot of clinical trial researchers, you'll need to go onto the PHRN website and submit an application for cross-jurisdictional data. So the benefit of the online application system is that you can use the same form for if you just want to submit a request, or if you want to submit an expression of interest or an application for data. And also, this is the one form that you'll use to obtain approval from all the different jurisdictions. It also enables the researchers to submit one application at the same time to all the data linkage units. Previously, this was not possible, but now we've got the online application system. It's a coordinated approach where once you submit it, all the data linkage units involved in your project will receive it at the same time. Applying through the online application system also allows you to track the progress of your application. It allows the other researchers on your team to view the application form, and it also allows you to manage all your documents in one place. But before you go on to complete the online application form, it's best to review the PHRN website and also the relevant jurisdictional data linkage unit websites, because they'll have information about their data collections on there and if there's any mandatory training that's required, and also the details of the application process. So once you've had a look at their website, it's probably best to also contact the client service teams. So for a cross-jurisdictional project, you can contact me, or you can contact any of the data linkage units that are involved in your project. And as I said previously, their contact details, the data linkage unit contact details are all on the PHRN website. You'll also need to register as a user of the PHRN online application system, and the other researchers in your team who want to be able to view the online application system will also have to register as a user. You'll also need to decide if you want to submit a quote or an expression of interest or an application. You'd only choose to request a quote if you are looking for just a simple ballpark estimate of how much your project would cost. And for quotes that are submitted through the online application system, we can usually get that back to you within 7 days. If you choose expression of interest, many of our applicants choose that one because that enables you to be provided with feedback from all the data linkage units about how to improve your application so that when it goes through to the data custodians, you're more likely to have a smooth approvals process. The preliminary feedback that client service units also can provide for you is they can look to see if what the purpose or what your research questions, if they'll be able to be answered by the data sets you've requested, the variables you've requested, and they can provide a guidance on what data is available, the years the data is available, the quality of the data, and suggest any changes that will help your project. I would only choose application if your research proposal is in a good enough state to be considered by data custodians. So it's generally best to go and apply for an expression of interest first. Now, when you actually log on to the online application system, there's mandatory fields that you'll need to complete. These include, they're very standard, what you would do for a normal grant application, but we're just looking for things like the project title, project duration, a summary, the background, aims, design, methodology of the study, the responsible institution, funding, the researchers that will be working on the project, any control group and cohort descriptions, what data sets you're looking for, your data management plan, and also if you've had any consumer participation involved in your project. Okay, so we've got to the point that we've submitted the data application, and this is the same process if you submit an application to a data linkage unit directly or through the online application system. So the client services team will receive your application and they'll review and provide advice about the data collections, the linkage methods, the approvals that you require, if your project is technically and practically feasible, how much your project will cost, and they'll assist you with negotiating with data custodians. There will be, at this stage, there will be a bit of toing and froing between you and the data linkage units. The applications may go back and forth a number of times to get the application in its best or good enough form to be sent on to the data custodians. So the next step is that the application is in a good enough state. The data linkage units say that yes, they think they can do your project, so they're going to take it to the data custodian for their approval. So it's a legislative requirement for most administrative data collections to have the data custodian give their approval prior to researchers accessing the data. For single and cross and multi-jurisdictional projects, they're all treated the same way at this stage. The data custodian generally provides in-principle support for the project or conditional approval, or they can reject the application outright, but generally they give in-principle support, and they won't give the final approval of the project until you've received ethics approval. At this stage, if the data custodians have given in-principle approval, the researchers will then receive a feasibility letter saying that the linkage is feasible and the data linkage unit is able to do your project. I'm just looking for an example. I'm thinking of the AHW, and if you're interested in applying for PBS data or MBS data, that process requires the data linkage unit on your behalf to apply for a public interest certificate. So that's, you'll apply to the AHW for approval, but they then take your application and negotiate with the Department of Health on your behalf to receive that public interest certificate. And another requirement from, if you're looking to link MBS or PBS data to your cohort, the data custodians require that all data is stored and analysed in the Shore facility, which I mentioned before when we were looking at the map of the network. That was the remote access laboratory. So that is one of the requirements, that you need to store and analyse the data with consent. No, that's without consent. When you don't have consent for the study, you'll need to put it into the Shore or go to the AHW's on-site secure data laboratory. There is a separate process if you have consent from the participants. Okay. So the next step is ethics approval. So the ethics application approval process is separate from the application for linked data process. And you'll need to submit at least one ethics application and be granted approval from at least one ethics committee for clinical trials involving linked data. However, if more than one jurisdiction is involved, keep in mind that you may have to apply for ethics in multiple jurisdictions. In some jurisdictions, a research governance review is also required, and that's separate to the ethics approval process. And data linkage units can provide advice on that aspect as well when you're speaking with them. So once your project has ethics approval, it's best to get, you'll receive the letter from the ethics committee, and then it's best for you to contact the data linkage unit and let them know that you've been given or granted ethics approval, because often the only advice that the data linkage unit receives that you have ethics approval is from yourselves, the researchers. So it's best to contact the data linkage unit and send them a copy of the approval letter, or upload it to the online application system if you're applying for cross-jurisdictional data. So once all the data custodians, so once you've got ethics approval, then the data custodian generally gives final approval, and that means you generally got all the approvals so that linkage and extraction of data for your project can proceed. So Felicity described the linkage process previously. So the data linkage unit will link the data collections for your trial. I'll just make a note that data linkage units often are working at capacity, and there is usually a queue for linkage. So that's something that may need to be factored into project timelines. If you have requested data to be linked to one of your clinical trial cohorts, you will need to provide the data linkage unit with linkage variables. On the slide, you can see I've listed what the linkage variables would be, and Felicity did touch on this earlier. All your participants would need a project record ID, and you'd need to provide the linkage unit with their names, their address, their date of birth, and their sex. Okay, and you'll also need to supply it in the format which is required by that data linkage unit. Sometimes this can differ between the data linkage units. And at this stage, you'll also have to decide who in the research team will be responsible for separating the linkage variables and transferring them to the linkage units. That's keeping in mind that the separation principle must also be practiced within the clinical trial group. Okay, so when the data linkage units have completed the linkage and created the project-specific linkage keys or used your project ID keys that you've provided, they'll then contact the data custodians to extract the data for your project. And the data custodians will extract the data and attach the relevant project-specific linkage keys, and then they will safely transfer that data to your home institution or whatever the location you said that the data will be stored. The data custodian will send it there. Now, when you receive the data, the first thing to do is check that the data that you've received matches the agreed specifications and approvals. If you notice any discrepancies, it's best to get in contact with the data linkage unit straight away, because you may require a re-extraction. And then when you've got the data that you asked for, you make sure you allow enough time to clean and format the data prior to beginning your analysis. Researchers often suggest allocating 3 to 6 months to clean the data, to clean and format the data, so you've all got it, that your data that you've in your merged data set will be standardized. Okay, so costs and timeframes. It's always a good idea to get a request for quote early on in the project, so you've got an idea of how much this project's going to cost you. Quite often people, if they're applying for grants, will ask for a quote, and then if they are successful with grant, will put in the expression of interest or application further down the track. So each data linkage unit has their own pricing and or charging policy, and there are different charges for client services, for linkage, for geocoding, for extraction. So it will differ a little bit from jurisdiction to jurisdiction. The charges will also depend on the size of your study and the complexity of the linkage, and then what needs to be extracted. So extractions, the cost depends generally on the number of data sets, the number of years of the data you're looking for, and the number of individuals in the data extract. The AHW actually has an example on their website of what some ballpark figures are if you wanted to do some linked data research with the National Death Index. And they suggest that if your cohort is less than 900,000 records and you want that linked to the NDI, the cost is estimated at between $3,500 to $5,000 excluding GST. If you've got the same number of participants, so less than 900,000, and you want to link to the MBS or PBS, the AHW suggests it could cost between $21,000 to $25,000 excluding GST. And there's also charges associated with storing and accessing your data through the SHORE, which is the Remote Access Laboratory, and it also does cost, I think, $600 to lodge an ethics application to the AHW Ethics Committee. As I said previously, if you'd like a quote for a cross-jurisdictional project, you would apply through the online application system. Jurisdiction data linkage units can also provide a cost estimate if you are just doing a study in one jurisdiction, and you can just contact the client services units there directly. I'm just having a think. Yeah, that's probably enough for the costs. And then when you're thinking about timeframes, at the outset, please remember that applying for linked data for your clinical trial involves a number of application and approval processes. This in itself is time-intensive work. So keep in mind that you've got to apply for the data custodian approval, so you have to go through an application process there. You need to apply to ethics committees and get their approvals, and there may be research governance review, specific assessments as well. There are also a number of other things that impact on both the time and cost of linked data projects. The main one being complexity. We sort of look and say, well, the more complex the project, the longer it could possibly take to do, and the more expensive it could be. So if your project requires new linkages or like a huge number of data sets, or it's got a complex design where it may be case control design, and the number of approvals that are required. So that can often increase the cost, but also the times that are required, because you could just imagine if you're wanting death data and hospital data from 3 jurisdictions, that in itself is having 6 data custodian approvals. You may have to get 3 ethics approvals and then also go through the research governance reviews. So that can also add to the time, just because there's so many different steps involved. And just keep in mind also that the workload of a data linkage unit or an ethics committee, that also can contribute to the time frame. So submitting an application around Christmas time can sometimes be problematic, with staff numbers being lower because staff are on leave. So just thinking about those sorts of things as well, they can contribute to timelines. But I'm going to finish up here, and I think the take-home message I want everyone to remember today is that applying for linked data does take time. So you really need to take the time to design your trial using data and methods that are appropriate for achieving the aims of your trial or your study. And at the very beginning, you need to speak to the data linkage units and the client services officers about your project. You need to also visit the PHRN website and the data linkage unit websites to get an idea of what the processes are in those jurisdictions and also what data is available. And please, don't be afraid to ask for assistance. The PHRN is a collaboration, and we're here to help researchers access administrative data sets for approved research purposes. So there's no silly questions, there's nothing, no one's going to question you if you say, what do I do next? We're a collaboration. Please contact the data linkage units or myself and we'll be happy to help. Okay. I'm happy to take some questions if anyone has any, Madeline.
Thank you so much, Natalie. That was great. So we do have some questions that have come in, and some outstanding questions that we had that relate more to Felicity's section of the talk.
Okay. Do you want me to take my questions first and then I'll pop Felicity on?
I think that would be great. So we've had one come in from Libby, who has asked, how important is it providing the correct address data to the data linkage unit, as the address can change frequently in some cohorts?
Right. Well, I might have to defer to Felicity for that one, and she can't hear the question. Libby's just asked me, when a clinical trial, the participants often can change addresses. So when you're providing the linkage variables to the data linkage unit, how sure do you have to be that this is the correct address? I'm going to put Felicity on, sorry.
So you would provide the most recent address that you have, but the beauty of probabilistic linkage is that's what data linkage units do all the time, is they're getting data about people where things have changed, and address is the most common one, and they're working out, they can take into account those changes and they still can link quite accurately. So it's not necessarily a big problem. I'll give it back.
Thanks, Felicity. I hope that answered your question, Libby.
Okay, thank you, Natalie. We had another question on the same topic, came in from Fanush earlier, And they were wondering if you can ask the specific method of data linkage that is going to be used for your project, or how you would know which linkage method was used.
Okay, yeah, so you can talk about that with the client service officers when you're designing your project. One of the good things if you're doing a cross-jurisdictional study is that when your application is submitted to the online application system, because everyone knows about your project at exactly the same time, we all get together and have a project planning meeting and we talk about how the linkage will be done. Now, there is some discrepancy within states and territories about how the linkage is done in certain areas, but we are trying to streamline that process. And every jurisdiction will provide the researcher with a linkage report when their data is delivered, so you will know what each jurisdiction has done regarding with the data. So that's one way of keeping track. But it's also, I think, really good if the researcher and the data linkage unit are having a conversation about how the linkage is done, and if the researcher feels strongly about a particular research method, that can be discussed among the group. And one of the beauties with the online application system, because everyone has the application, I can easily organise project planning meetings or additional meetings if there's certain issues that the data linkage units need to hash out and discuss further, which can often be how we're going to link this data and what methods we're going to use. You don't actually, in your online application form, the researcher doesn't have to specify what data linkage methods the data linkage units will use. They really just need to specify their methods and what data analysis or tools they'll be using and what methods they'll be using to analyse the data.
Thank you so much for that, Natalie. We have another question which has come in from Rachel, and it pertains to one of Felicity's slides earlier where she outlined the flow of data. So in Felicity's diagram, it goes from trial sites to data linkage units, and she did mention that there were other models that could be used. Could you give us a little bit more information about that?
We were just talking about the other models that could come up with this scenario. So, I mean, you could start off having a coordinating site up the top, so the study sites would feed initially into the coordinating site, and then the coordinating site would then send the identifiers and the study ID to the data linkage unit. So that is another way of doing it. You will always have to, at some stage, provide identifiers and the study ID to the DLU. So it can either come from the study site. It's sort of, I suppose, if you're thinking about a clinical trial which may involve 50 hospitals, you probably wouldn't want 50 hospitals sending the identifiers and study IDs to the DLU. You would want a coordinating site. So even if it's just a state coordinating site or a central coordinating site, you would want someone to be responsible for transferring and sending all that data together. I would imagine that's what the data linkage units would want. I'll get Felicity to comment.
Yes, that's all. That central sort of option of the coordinating site sending it there is really is that often they don't want the names and addresses sent to coordinating sites and held centrally. So if that's not part of your study design, then I think you probably would have to do it site by site. But there's no rules, you have to do it this way, so I think you work out what's going to work best for your particular clinical trial.
Thanks, Felicity. Now, we've just had a question come in earlier from Lisa for you about what order the approvals need to be collected in. So do you need approval from the custodians and then ethics, or is it flexible?
Okay, there are slight variations between jurisdictions, but mostly it's data custodian first and then on to ethics. And I think if you've got a choice, if some jurisdictions are a bit flexible, I would always go data custodian first, because that can impact on the actual design that you're using and which variables you're able to collect or not. And then if you go to ethics first and they approve your study, and then you go to the data custodians and they say, but you can't do it that way, then you're going back to ethics for an amendment. So I think if you've got the choice, go data custodian first.
Great, thank you. We've also had a question come in from Hannah about, do you have any tips for incentivising any trials units to take part in new data linkage efforts, particularly if they're a small CTU?
Oh gosh, that's probably not something I've put my mind to. Look, I think it's not so much incentivising. I think if it makes sense and it's going to improve the quality of your trial, then this is the path to go down. But it's not necessarily the best option for all trials. It really, I think it's a case-by-case thing. It's another option out there that may make sense for some trials, but may not make sense for all.
Okay, great. Thank you for that. Dana has also asked if there's any information about the ease or simplicity of accessing certain data sets over others.
Oh, well, general rule of thumb is if a data set is routinely linked by a data linkage unit, it will be much easier to access than something that is either never been linked before or is rarely linked. So things like admitted patients, births, deaths, emergency department, cancer registries, all linked by all jurisdictions in the country and routinely linked frequently. But things that are less commonly linked at the moment would be things like notifiable diseases, pathology, not always routinely linked. So, and you may have found a data collection that you think is of great interest, but just has never been linked before. If that's the case, there will A, be time in negotiating with that data custodian for access, and then B, extra time in actually doing the linkage of that for the first time.
Thanks so much, Felicity. I think we might just do one more question to finish up because we're about out of time. Leah has just asked about any authorship expectations from the PHRN and whether there are different cost structures depending on the nature of the service or the collaboration.
Okay, so I'll start with the authorship question. Most data linkage units would want you to acknowledge them in your publication, acknowledge that you had used the service, and NCRIS is very keen for you to acknowledge NCRIS if you've used an NCRIS funded facility. But no authorship. There's no expectations that the staff in the linkage units would be authors on your papers. And then the second part of the question, just remind me what that was. About
it was just
costs.
In relation to costs and whether that would vary depending on the nature of the collaboration or the service.
Yes, it does. So think of accessing linked data at the moment as buying a tailor-made suit, in that it depends on exactly what fabric you choose and the exact design, how much it's going to cost.
Fantastic, thanks for that. So I think we will just wrap up there unless there's anything else that you wanted to add.
No, that's all from me.
Okay, great. Well, thank you everyone for coming along today, and thank you so much to Felicity and Natalie for presenting and taking us through how to access data using PHRN. All of our attendees, just a reminder to head to our website for recordings of these webinars, particularly if you missed the first webinar that happened last week, and meet us again for the next one, next Wednesday at 1 p.m. Daylight Time. So thanks again for joining us today, and we hope that's been an informative and useful webinar. Thanks so much.
Thank you. Bye.